I'm going to do my persuasive speech today on abstinence in high school teaching and on contraceptives, on allowing condoms in high school. Most schools teach abstinence only, but with the average of 53% of high school students having sex, is anyone listening? In the 1950s, people worried about unplanned pregnancies, but today we have to worry about fatal STDs. 25% of all new HIV infections are in the 13 to 20-year-old range. This according to Brown, Penny Legion, and Hillard. If ignorance is bliss, our youth are in ecstasy. Education and making contraceptives available in schools will promote safe sex and reduce the number of unplanned pregnancies in our youth. So I'm going to persuade you that our school curriculum needs to reflect the times and contraceptives should be available in our high schools. This would not promote sexual activity, but reduce sexually transmitted disease and unplanned pregnancies. Education is key. What little is taught about sex in high school is horrible. The only message that is usually getting out there is if you have sex before marriage, you'll probably die or get pregnant and live a horrible life. These courses typically use fear and shame to support abstinence. We need to change the curriculum in our high schools to educate our youth. Our schools do not need to teach personal values and morals based on specific religious beliefs, but factual information about sex education. Let the parents mandate what morals and values of their children should adhere to. Churches and state are separate and should stay that way, especially for sex education. The AMA recently released the following statement: sex education that provides information about abstinence, condom use, and other contraceptive methods is the most effective way to reduce the growing number of teenagers who contract a sexually transmitted infection or become pregnant. As the AMA pointed out, the form of education we currently use is not effective. We can't just stick our heads in the sand and expect the numbers of STDs and unplanned pregnancies to go away. According to medicine.net, the United States has the highest teenage pregnancy rate of all developed countries. With this visual aid, it shows countries such as Great Britain and Belgium who do teach other methods besides abstinence only, having much lower rates than the United States. Education aided with the availability of contraceptives in our schools will reduce STDs and teen pregnancy. According to pregnancyinfo.net, 84 out of 1,000 teenage girls will become pregnant in the United States. 80% of those teens will end up on welfare. This means that right now, 84 girls will become pregnant at Meridian High School, since the average population ranges around 2,000, assuming half are girls. When I was a teenager at Meridian High School in 1980, at least 10 personal friends became pregnant before they were seniors. One friend in particular gave her baby up for adoption, and this affected her for the rest of her life. The objection is changing the current curriculum and providing our youth with contraceptives in schools is giving them the permission to have sex. I will explain further in my speech that this is not factual. In fact, it is further from the truth. Changing our teaching curriculum will help, but providing discreet access to contraceptives will reduce the STDs and unplanned pregnancies. Our youth do not need to be embarrassed by sneaking down to local Walgreens to buy condoms. If we provide them with contraceptives and information, they will use it. By not providing the proper information and tools, we will keep the statistics on teen pregnancy and rapidly increasing cases of STD among our young. This is not the time to bury our heads in the sand with the number of STDs and unplanned pregnancies in the U.S. Do you want our youth to die from a preventable STD? Do you want your baby having a baby? I don't. I want to inform my children at home about the risk of having sex, provide them with the right information, and have the talk that all parents and youngsters dread. But many homes don't have that talk, and those are the ones we need to target in our schools with the proper education and contraceptives to prevent this from happening. By providing the accurate information to our teens, we can eliminate some of the secrets and shame about having sex. It does not need to be kept in the dark because it's causing too many hardships in our country. Countries such as Sweden and Denmark are very open about sex, and their country's teenage pregnancies and STDs are the lowest in the world. One of the biggest fallacies about changing the current curriculum in our schools and providing contraceptives is that we will support our teens having sex. By providing accurate information, we are not saying it's okay to have sex, and I personally don't know anyone who asked their parents prior to engaging in a sexual relationship. Another fallacy is if we promote condoms in schools, we'll actually increase STDs. On the Opposing View website, www.opposingviews.com, there are such words as disgusting latex in our schools, a bunch of blather from Planned Parenthood, and they actually come out and accuse Planned Parenthood motives on informing teenagers about condoms because eventually that teenager will get an STD and then they will have to go to Planned Parenthood to get it treated. Therefore, Planned Parenthood is getting a leg up on the competition by having their customers get a disease they can treat. So, by providing condoms in our schools, we provide safety for our youth. How can the factual information about having sex increase an STD? We don't want our teenagers having sex, but we do want informed youth. We don't want our babies having babies. So in conclusion, we have seen the statistics about teen pregnancy and STDs. We know the curriculum we are using in the United States today is not working. Providing our young with the right information and providing contraceptives in a safe, non-threatening manner will reduce these statistics in the United States, decreasing the number of unwanted pregnancies and STDs. We don't want any more children being born to children. I have discussed the importance of condoms and better educations in our schools. We as a group need to make this change happen for our children's future. As adults, we need to step out of our comfort zone and leave our moral compass behind and make the necessary changes for our youth. So, I implore you to think about not to think about how you feel today, but how you felt at 16. Teaching from an adult standpoint is not going to work. We need to teach the feelings and emotions that young people are facing and eliminate all the heartache having unprotected sex can bring. It is time we got off our high horse and faced a reality that is not going to change just because we don't want to face it. Read up on the statistics yourself. Contact your child's school and find out what their stance on sex education is. And finally, talk to your kids. Forget how uncomfortable both of you feel and focus on getting the information across to your child. Remember, they will make the decision to have sex with or without your permission. At least inform them on how to be safe. As my grandma used to say, act in haste, regret in leisure. Let's act in haste to change our school's teaching methods and provide our youth with contraceptives so we don't have to regret in leisure for our children. And does anybody have any questions about the speech? Okay, thank you. And then hand the audience. Thank you, thank you.
Emma, do you have any questions?
Okay.